Into Soda City Living. February is American Heart Month, and today we're going to be talking about hypertensive heart disease. Joining us today is Dr. Joshua Coney of MUSC Health. He's going to share more information about what hypertensive heart disease is, and we're so glad to have you joining us today.
Well, thank you for inviting me. I appreciate it.
So, Dr. Coney, what is hypertensive heart disease?
So hypertensive heart disease is a mix of complications that affect the heart due to hypertension or high blood pressure. The factors that cause hypertension include sleep apnea, insomnia, stress, other cardiac conditions, alcoholism, genetic issues, as well as many other things that can do it.
So a person who has hypertension, they are at risk for this, correct?
Every patient who has hypertension is at risk for hypertensive heart disease.
What do treatment options look like for a person with hypertensive heart disease?
Well, typically we start patients off with medications. There are a few that are typical for all patients and some specifically made for different ethnicities. For my patients, I usually start with some type of water pill, which is a diuretic, helps you to release more pressure by urinating more out of your body, and a medication that is a vasodilator of some type, which will increase the ability of your heart to push blood easier, okay? Lastly, there are some medications that we don't typically use but are very, very successful, which would include patches or sublingual or under-the-tongue medications.
Perfect. And long-term management for hypertensive heart disease, what does that look like, long-term management?
Long-term management is usually you seeing your primary cardiologist or your primary MD if your blood pressure is well controlled for a long period of time, and just monitoring to make sure that your blood pressure stays within the limits that we want it to prevent you from having hypertensive heart disease or worsening hypertensive heart disease. There is proof that if you control your blood pressure, despite having hypertensive heart disease, it will reverse.
And there is a way for folks who are living with this condition to maintain functionality of their life. What does the day in a life look like for a person who is living with this disorder?
Typically, they live a very regular day as long as they take their medicines in the morning and sometimes in the evening. Other than that, they live their regular life and just watch what they eat, they exercise, they make sure they have the right diet, which is a separate point I think we should discuss. Typically, for most people who are eating, I tell them to eat foods that have less feet, meaning if you have 4 feet, which is your beef, your lamb, and such things, pork, is probably not as beneficial for you as it is to eat things that have less than that. So your 2-footed animals, which is your birds, your poultry, or 1 foot, consider that a fin or for your fish. And lastly, no feet vegetables. And you should have more from the bottom to the top. So more vegetables and fish than having your poultry and your red meat.
That is such a unique way of looking at it. Instead of you just coming out and saying, eating poultry or eating less red meats, you're like, if the less feet it has, the better. That should be an easy way for everyone to remember.
That's right. But if it has 3 feet, I would keep away from it because it's probably sick.
So how does one get tested for that condition?
So first you would have to have the diagnosis of hypertension, which would include a systolic blood pressure greater than 130 if you have other conditions, or 140 if you have no other conditions. Those first would be the prerequisites to have hypertensive heart disease. And you usually would get imaging of the heart over time to monitor to see if your heart is being affected negatively by hypertension.
Dr. Coney, what are some things that you look for as a cardiologist when you have a patient that has the symptoms of hypertensive heart disease?
Typically, hypertensive heart disease will affect you by either causing you to have headaches, you can have swelling in your legs, you can have shortness of breath, you can have dizziness or changes in your vision. Many patients also present with kidney failure, strokes, and pains in the chest.
And would you say there's a particular group that is more at risk, or age group?
Yes, typically hypertensive heart disease develops after having hypertension for at least 10 years, and usually that's the age between 40s to 60s years old.
Mostly women, mostly men?
Typically more men before the age of 55, but it evens out after you turn 55 as a woman.
Absolutely. Are there any preventative measures? I know obviously some of the things that we can help with hypertension, but anything that helps with managing or prevention for those who are at risk?
Of course, there's always prevention. Prevention is much better than a cure. And so the first things I would say is if you have hypertension, take your medicine. That's the first thing you should do. Staying compliant with medicine is a very important thing. Obviously, it will keep your blood pressure down to avoid the complications of long-term uncontrolled hypertension. Additionally, you could exercise. Keeping active increases the expansion of your arteries. Better expansion lowers your blood pressure risk. Eating healthily, lowering your salt intake, not overhydrating with salty drinks such as Gatorades if you're not going to be exercising. Sleeping well, getting at least 8 hours of sleep is very good for you. Taking care of your dentition can increase your risk of hypertension. Also, having less stress. So that could include doing yoga or Pilates, having more time with friends or spending time with family, even having a behavioral therapist to sit down with you to discuss and vent every once in a while.
All very great ways to kind of help with managing stress. One of my last questions, I want to go back. You mentioned to making sure you're controlling your symptoms or managing. What is the downfall of not managing your hypertension or hypertensive heart disease? What could then happen if things get out of whack?
The major risk factors for uncontrolled hypertension are heart failure, where your heart stops being able to move blood forward in the way it should, and it backs up into your lungs and elsewhere in the body. Secondly, you have stroke. Major strokes can happen from high blood pressure that is uncontrolled. And lastly, untimely or sudden death.
Oh my goodness, those are very, very serious, and that's why it's so important for you to regularly check up, pay attention to your body, and of course, go to your primary physician to be recommended or referred. Well, Dr. Coney, thank you so much for joining us. We'll be sure to have these details along with the number if you'd like to contact where Dr. Coney is so you can schedule an appointment. We'll have that on our website, sodacityliving.com. Stick with us. We have much more coming up after the break.